Obviously, this has been the holy grail for Republicans over the last 6-7 years, was we got to kill Obamacare. Now, that has been taken as an article of faith, that this is terrible, it doesn't work, and we have to undo it. But now that Republicans are in charge, they got to take a look and say, let's see, we got 20 million people who have health insurance who didn't have it before. Healthcare costs generally have gone up at a significantly slower rate since Obamacare was passed than they did before, which has saved the federal treasury hundreds of billions of dollars. People who have health insurance are benefiting in all sorts of ways that they may not be aware of, everything from no longer having lifetime limits on the claims that they can make, to seniors getting prescription drug discounts under Medicare, to free mammograms. Now, it's one thing to characterize this thing as not working when it's just an abstraction. Now, suddenly, you're in charge and you're going to repeal it. Okay, well, what happens to those 20 million people who have health insurance? Are you going to just kick them off and suddenly they don't have health insurance? And in what ways are their lives better because of that? Are you going to repeal the provision that ensures that if you do have health insurance on your job and you lose your job, or you change jobs, or you start a small business, that you're not discriminated against because you got a pre-existing condition? That's really popular. How are you going to replace it? Are you going to change the policy that kids can stay on their parents' health insurance plan until they're 26? How are you going to approach all these issues? Now, my view is that if they can come up with something better that actually works, and a year or two after they've replaced the Affordable Care Act with their own plan, that 25 million people have health insurance and it's cheaper and better and running smoothly, I'll be the first ones to say, that's great. Congratulations. If, on the other hand, whatever they're proposing results in millions of people losing coverage and results in people who already have health insurance losing protections that were contained in the legislation, then we're going to have a problem. And I think that's not going to be unique to me. I think the American people will respond that way.